You are welcome to my channel. Thanks for visiting. Though I have published a separate presentation on prostate cancer, but I'll be going through an excerpt that will focus solely on the symptoms of prostate cancer. If you want to listen to the full presentation, you can click on this very link. But as far as the symptoms of prostate cancer will be the focus, we're going to delve into that right here today. You need to know that before you even reach the symptoms at all, you will go through some necessary aspects of this presentation, like the organs involved. We'll describe the prostate gland itself, the neighboring structures, all will be described. So without further ado, let's go. Let's find out. Is it true that some people who have prostate cancer, they will not even know for years until they die natural death or they die due to another reason or reasons? If that is true or not, we're going to find out here. So let's go. But please remember to subscribe to my channel. Remember to spread this to all male individuals in your life. I appreciate it. Okay, let's get to the business. Prostate cancer. You know what this really stands for, right? Now, prostate gland is the main gland that we'll be addressing here. But it's living in a community with some other neighbors, like renal system, gastrointestinal tract, and then when the cancer is moving around, it can go into the bones. Actually, it can spread anywhere, so all systems could be affected later on when it's pretty bad. Now, I've just said it. So when we're talking about prostate, the prostate will be somewhere here, but see the neighbors. This is adrenal gland. We will talk about this when it comes to hormonal therapy, okay, and the production of testosterone. This is the kidney. You can see the relationship between the kidney, the ureter here, that will pass the content from the kidney into the bladder, and this is the bladder neck, where the prostate, will be sitting, okay, it will be located. So the urethra will pass through the prostate also. The urethra will be compressed by the enlarged prostate, just as it's going to compress the bladder neck and the nerve, bundles around. So the urethra, TH, is different from ureter. Ureter is coming directly from the kidney into the bladder, while the urethra, TH, will take it out. Okay, so you can see the organs that are pretty close. We cannot see seminal vesicles here. No, I'll go into that in a bit. Now, there's no way we can talk about prostate cancer in details without referring to the gastrointestinal tract, particularly the large intestine, the anus, the rectum. Now, someone will ask, why bringing that skeleton here? Just to let you know, when we talk about metastasis, and we say metastasis to the bone, so it can spread everywhere. Now, the spinal cord is right inside the vertebrae, yeah? And even the brain can be affected in the central nervous system, right? And then, the entire skeletal system. Now, the prostate gland. This is one major bust along the journey of full information about prostatic cancer. Don't mind my sketch, I'm not a good artist. You can see the bladder here, okay? And just below the bladder, now the bladder neck, you can see down here, you will see the prostate gland itself, right? Mm. But you can see at this angle seminal vesicle. We'll talk about that later on. See the rectum and the anus. Now they are good neighbors, right? So from the anus, the probe of transrectal ultrasound could be passed, and the view of prostate is possible here. Okay. Then, if you look very carefully, you can see the testes, right? Now, some will call it testicle. Okay. And on top of it is the epididymis. And from there, you can see the vas deferens. Now, the vas deferens will go through and reach the seminal vesicle, then empty into this long one called urethra, urethra, okay? And the urethra, you could see, is passing through the prostate itself. And then the urethra will go through the penile and then empty outside. So you have seen how the prostate can affect the flow of urine. Then we have obstructive uropathy. I will go into full in a bit while talking about signs and symptoms. Then you can see that the testes that will be producing now testosterone is not far from where testosterone could have affected the prostate gland itself. And then this is the reason why we'll be talking about reproduction in male and the problem with prostate cancer and the probability of erectile dysfunction and oligospermia, azoospermia, painful ejaculation, and even infertility. All because you have seen the relationship between the testes, epididymis, vas deferens, seminal vesicle, including prostate gland itself, that will produce one or two things to form the semen. So, yeah. Now, let me take you through some other things about the prostate gland. First of all, you need someone by your side from beginning till your full recovery when it comes to prostate cancer management. Now, the prostate gland itself is a sex gland in male, just like the testes or testicles, as you may call it, that are in Britain, UK or North America, just like seminal vesicles, testicles, and prostate gland. They are interrelated when it comes to male reproductive system. The prostate gland secretes fluid that will make up the semen just like seminal vesicles would do. Now, about the size of the prostate gland is just like the size of a walnut or ping pong ball. It is situated below the bladder. You can see right here. This is the bladder here, and this is the prostate gland. Okay? It surrounds the upper part of the urethra. That is why when it is enlarged, either as a result of benign prostatic hyperplasia or as a result of the cancer, is going to compress the urethra, and then the flow of urine will be appreciably affected. The prostate gland is affected by sex hormones, and then the sex hormones there will do few things. It can stimulate the prostate gland activities, and also facilitates the replacement of the worn out cells of the prostate gland. So, uh, here, testosterone is the chief commander that will do all these things. And the testosterone is produced right here from the testes. Some could be produced by the prostate gland, while some could be produced by adrenal gland, but majorly produced by the testicles. Okay, uh, it's a small, organ, the prostate gland, but when it is enlarged, then it gives us a big problem. When it is fed before any cancer, it is going to be robbery. Now, what are the functions of this prostate gland? Uh, it's responsible, in part, for the seminal fluid production and plays a role in hormone production as well. It helps to regulate urine flow. You can see that when it is enlarged, it's going to compress the flow of urine. There may be some problems associated with this prostate gland, like inflammation can occur here called prostatitis. When that happens, PSA level will be raised as well, just as it's going to be when there's benign. Benign means you don't need to run around. It's not likely going to kill you. Benign prostatic hyperplasia, right? And then another problem here is what we're addressing today. Prostatic carcinoma can all occur right here, in the prostate gland. Now, let me quickly touch on, I've been talking about lower urinary tract symptoms, So when this prostate gland is enlarged, then there'll be difficulty urinating and the individual may be straining because you are forcing the urine through this bladder to pass through the enlarged prostate that is compressing the urethra, the one with, TH, urethra, that will allow the urine to flow to the, outside of the man. I don't want to be repeating the name of that organ. You know what I'm talking about. So, the individual will have poor stream or weak urine flow, and the individual after peeing will feel as if the urine is still retained inside the bladder, incomplete empty. Not just feeling alone, that is the reality, because it's not going to flow, fully. So weak flow or poor stream. Then bladder control will become poor somehow. So as a matter of fact, you have what is called urge incontinence. Then you can have hesitancy, you are about to pee, but you are afraid because it's difficult, it can be painful, so you hesitate to go to the toilet or washroom to pee. Then, because of this incomplete emptying, then you'll be having what is known as intermittent stream. It comes, stop, comes again, and then after you have peed, part of it will be dribbling, post-micturition dribbling. And then you'll be there, in the toilet or washroom for a long time, so prolonged micturition. All these are what we collectively refer to as obstructive uropathy signs and symptoms. But at the same time, when you now have urinary retention in the bladder for a long time and you can't get it out, there may be backflow to the ureter, that is without H, ureter. And that one will also go back to the kidney, giving us hydronephrosis. So when this retention is taking place, that may be urinary tract infection right here, and then you then have irritative symptoms on top of the obstructive symptoms. And then you have frequency, urgency, you have nocturia and dysuria on top. So in females, there is no prostate gland per se, but we have a look-alike, which is known as homologous structure, called Skin's gland, and that is SKENE, now gland. That will secrete a whitish or viscous substance that will be released during female action. You understand what I'm talking about? I don't want to go into details of that. So there's no prostate gland per se in female, but we have homologous structure. They look alike. That is formed closely like the way prostate gland is being formed during embryogenesis. So the Skin's gland can also secrete PSA in females and PSA phosphatase. Though it is very rare, but the cancer of the skin gland may occur as well in females. It is related to something, and then I'm going to stop the details about prostate gland there. Like in men, it can serve as G-spot. Okay, so let's leave that as the detailed information about the prostate gland. Okay, I'm about to move away from the description of the prostate gland, but it will be incomplete without describing the histological zones. So the zones of the prostate gland. My poor sketch notwithstanding, pardon me, I'm not a good person when it comes to drawing. The important thing is passing the info across. So this is the prostate gland. This is the posterior part. The rectum is supposed to be somewhere here, and this is the anterior part. Okay. You can see the ureter coming from the kidney, dumping the urine in the bladder. The bladder is a sac, and here is the bladder neck. The urethra is going through. The TH1, right, is going through. Then anteriorly here is the fibromuscular stroma. That contains both smooth and striated muscles, and they form the internal and external urethral sphincter. That is fibromuscular, striated, and smooth muscle. Okay. Then we have the transitional zone. Remember the density the other time, right? And I said it's the part that surrounds the urethra. You see the urethra is passing through here, and the transitional zone of the prostate gland is surrounding it. This is the part that commonly becomes affected when we are dealing with BPH, benign prostatic hyperplasia. You can see why BPH could be very troublesome when it comes to obstructive uropathy, because when this is enlarged pretty close to the urethra, so easily it's going to compress it. That is transitional zone. Then we'll see the urethra. Okay, I'm getting to the peripheral zone. The peripheral zone is the largest of all the zones. If you just merely looking at it without even measuring anything, you can see that it is the largest. And it's right there at the back, posteriorly, okay, compared to the rest zones, right? So peripheral zone is the largest part, almost about 2/3 of the entire prostate gland histologically. Here, it is significant in the sense that it is located posteriorly. When I started, I said the rectum is supposed to be somewhere here. So when digital rectal examination is done, we are going to be feeling this. So the physician will feel almost the 2/3 of the prostate gland, but you'll be feeling the peripheral zone. So what about the other parts, of the prostate gland? And also another important fact about peripheral zone is this is where prostatitis occurs commonly. And from there, it's going to spread to other parts of the body. And can anyone take a guess why it is that so? Well, and someone else might provide the reason, but my guess is since it is posterior and pretty close to the rectum. You understand now? Okay, so prostatitis from here, digital rectal examination ourselves will give us the picture of what is happening here. You know, hard, craggy, whatever you pick. Then you can see the ejaculatory duct, right? That's not part of these zones. So it's not passing through here and obliquely connected here, right? Then the last zone that I'm going to talk about is central zone. You can see the central zone here, and is surrounding what I've just mentioned now, ejaculatory duct. That is the central zone. So finally, prostate gland has 4 zones: fibromuscular stroma, transitional, peripheral, central. Ejaculatory duct is passing through the central zone. The transitional zone is the one caging the urethra, while the fibromuscular stroma is supplying smooth and striated muscles to guard the internal and external urethral sphincter. Thanks for listening. Let's move on. Okay, we have left the region of risk factors. We are now inside the bus, carrying on to symptoms and signs of prostate cancer. Interesting. Prostate cancer, mostly asymptomatic, I will address that, but when we pick symptoms later, none of those symptoms will be pathognomonic of prostate cancer. In other words, none of the possible symptoms will be specific. Unlike so many other conditions, when you pick a certain symptom or symptoms, then you can say, oh, this is the disease, right? In this case, you will not. Nothing is fixed. It's all over the map. Why that? Look at this structure again. If the cancer is limited to the prostate gland, it's not affecting neighboring structures, and you have symptoms, you still find symptoms of obstructive uropathy, difficulty pain, incomplete, micturition, and intermittent micturition, interruption, nocturia, and so on will still be picked. But you can't say when you are having that, then it is the cancer of the prostate that is responsible. Why is it that we can't say that? We can't say that because it might be benign prostatic hyperplasia. It might be stricture. It might be bladder it might be cancer of the neck or the bladder. It might be stone in the bladder that is causing. Yeah. So if we move away from that, if the prostate is so enlarged and is affecting other structures around, now oligospermia or exospermia, it might not be prostate gland that is responsible. It might be testicular problem. Okay. Then if we are saying, okay, there is pain, pelvic region pain, what if the pain is associated with bladder, is associated with, large intestine, rectum, and anal region? Could be. So when we start talking about the signs and symptoms, there's nothing specific that we will see and say, oh, because Mr. So is having that, then that is prostate cancer. No. Okay, I decided to put this there just to make it clearer about what we are getting into when it comes to the symptoms. So once upon a time, this man had apparent good health condition, so apparently well. That's why I say good health status. But the cancer, prostate cancer, has come in, and then the condition is getting worse and worse. So, like you're climbing up the ladder, and at the plateau here is the treatment. So, the treatment will go to either one direction or the other, either good if we are picking the cancer early enough with appropriate intervention and good supportive system. So the person might come back to good health again. But if from good health the cancer was picked late and the treatment we could give would just be palliative, no hope of complete recovery, then we should prepare our minds and the mind of the affected individual that you are likely going to go down the ladder, meaning the condition will be degenerating more and more as days, weeks, months, will be passing by. And until we say, rest in peace. So, what are those things that we will be dealing with? Lower urinary tract symptoms, hydronephrosis, nerve compression, bone pain, spinal cord compression, thigh pain, gastrointestinal problems will affect hematology, reproduction will be affected, sitting will become uncomfortable, can affect the brain. Then the individual will get to this point, end of life, and then sleep, rest in peace. No, prostate cancer is that bad. But remember, if picked early and we embark on interventions, we might get the individual back on his feet. But if picked late and we can't, because it will reach a stage if it is bad before the diagnosis, there are so many interventions that we will skip. Like, you don't need surgery again for late stage. You don't need it. We just do the therapy, do some chemotherapy, and then continue palliative. You won't bother yourself about so many things anymore. So, this will inform the need for us to listen to this presentation again and make up our mind to see our physician. Now, the symptoms. Asymptomatic. Asymptomatic. Majority of people with prostate cancer will not have symptoms And with that, this cancer will grow very slowly and may never have any signs and symptoms until the individual dies naturally or dies of another cause. Okay? Okay, I think you can still remember my explanation on good health, but the condition is getting worse and worse, and then the diagnosis is made, that will be late. Treatment is not just going to ameliorate the entire condition and then back to the fit again, no, but degenerating and then death. The other side of it is the man was, once upon a time in good health, but fortunately we could pick the cancer early enough, interventions were embarked upon, and is now back on his feet in good health. Now, we have moved away from asymptomatic. Now, somebody is now having symptoms. What is lower urinary tract signs and symptoms all about? Okay, number one, increased frequency of urination. The individual will be going to the toilet or washroom more than necessary. That is why I said nothing is pathognomonic here. This can happen in benign prostatic hyperplasia, can happen in diabetes mellitus, can happen with urinary tract infection. Okay? So, increased frequency and urgency. In fact, urge incontinence, we said. Then, when the individual gets to the toilet or washroom and is voiding, he won't be able to finish. He will think it was done, only to get out and get back again to continue. Incomplete voiding, because parts will be retained. Then, after urinating, there will be dribbling, post-micturition dribbling. At night, can be getting up to pee, that is nocturia, and painful micturition, dysuria. Then one interesting thing is while peeing, it will be interrupted. So the urine will come, will stop, will continue again, but this individual will even be straining to pee because there will be difficulty in peeing, in urinating. Then the individual will notice that the stream will be very weak. And at the point when the enlarged prostate is so massive that the urethra, that is with TH, have been compressed appreciably, then the amount of urine produced will drop, oliguria, very small amount. Then when some people might not expect this, but it's a possibility. When it becomes so massive that it has compressed the urethra and it has been completely obstructed, then we can have anuria. Okay. At this time also, the urine will flow back when it's not getting out. Will flow back to the bladder, from bladder, go through the ureter without H, ureter will go back to the kidney. Then the kidney will start retaining the urine that is expected to be passed out, to be voided. So the kidney will become enlarged, hydronephrosis, water in the nephrons. Okay. And with that, retention of urine can serve as the incubating space for bacteria. And then we have urinary tract infection because there is urinary retention. And then we'll be dealing with irritative symptoms of the urinary tract. And that will be burning while peeing, pain while urinating, feeling of incomplete emptying, and there might be hematuria. And the feeling of pressure in the groin is part of lower urinary tract infection or obstructive uropathy. And then with irritative symptoms, with inflammatory process going on, with urinary tract infection now because the urine is staying longer than expected, there can be fever, nausea, vomiting, and discharge per the urethra is possible. And then the urine will be cloudy in color. So all these things can be going on when urinary system is being obstructed, obstructive uropathy. Now, reproductive organs will not be spared. Remember the diagram that the neighbors will include the testes, the epididymis, the vas deferens, seminal vesicles. So in men, when the prostate is in trouble, all those organs could be in trouble. And when they're in trouble, it's going to cause trouble for the man as per reproduction. So the man can start having painful ejaculation and can have what is known as erectile dysfunction, and then oligospermia in the sense that the vas deferens, okay, will empty into the urethra, but the prostate gland, when it is massively enlarged, can also occlude the vas deferens. At the point where it's emptying into the urethra. And with that, the reduction in the volume of semen that will get to the urethra and get out, to the appropriate place. And when that is massive, it can occlude it completely or even cut off the supply from seminal vesicles, then leading to azoospermia. So infertility is not far away here. So then, if this man is a young man, or not so young, but men can still produce semen, now 60, 65, they're still fine, although the quantity will decrease with age, but you can still help this man if he still wants, offspring, children. Harvest this semen and bank it for him before, embarking on treatment, because part of the treatment may affect, erectile, it might cause erectile dysfunction and infertility also. So the best thing is from the beginning. Do you want to have more kids? If the answer is yes, and desperately so, then we'll harvest the semen and bank, search for him. Then certain medications for erectile dysfunction can be used after the treatment to enhance, performance. But recovery will be a factor of functionality of the man before the prostate cancer and the interventions that followed. You understand? Okay, let me explain further here. Someone that had been very active in this regard, now having prostate cancer, undergoing treatment, when recovery is expected, it's more likely that you will recover faster than someone who had not been so active before in that regard. You know what I'm saying? That I don't have to repeat it. So recovery is a function of pre-morbid functionality. The individual with higher functionality in that regard will likely recover faster than someone who had been weak before. Then you can use condom if your wife is pregnant. The reason is that if you have brachytherapy, and you don't want to pass the the pellets of the radioactive agent into your wife and then cause teratogenicity and so on, then use condom, please. Don't make efforts to impregnate your wife until 2 years post radiation, because you can still pass the radioactive material to your wife, and teratogenicity is not good at any part of the pregnancy time, either first trimester, second or third, but it is worse and more horrible when that will occur in the first trimester. So the best advice is no effort to impregnate your wife until you have stayed 2 years post radiation. That is why we said we were advised that semen harvesting should take place and be banned. Okay? And once that is done, and your wife can use that for pregnancy, but the two of you can still be together all the time, but use condom. You will get rid of condom when you are 2 years after the last radiation to that pelvic region. Another problem is nerve impingement. Remember that the prostate gland is surrounded by the flanked by neurovascular bond. So that has sympathetic, parasympathetic, and sensory innervation from inferior hypogastric plexus, and the bundle will travel through the pelvic floor towards the penile region, helping in erection. During treatment or in the process of trying to make the definitive diagnosis, the neurovascular bundle could be tampered with. We will get into that at appropriate time. But as per the signs and symptoms of prostate cancer, when the prostate is enlarged, it will have pressure effect on the neurovascular bundles by the flank. So in that case, the individual could present with tingling and pain. There may be leg weakness and sometimes falls and paralysis. Let me pause and explain here better. Remember, when I was giving tribute to that legal icon who had passed on, the first sign was frequent falling. It started falling down while walking. No, just walking to his vehicle, walking, um, around the uh, legal office and at home. So leg weakness, frequent falls, paralysis can all happen because the prostate cancer is so big and is impinging on the neurovascular bundle. Then there may be urinary incontinence, fecal incontinence, and of course, erectile dysfunction. Another set of symptoms will manifest when metastasis has occurred and is affecting the bone, the spinal cord, and the brain. When it is about the bone, the individual can have bone pain, and the first sign of that might be thigh pain. And when it's affecting the vertebra, it's going to compress the spinal cord. And you understand what that may lead to. Paralysis, right? And even back pain. So there may be thigh pain, bone pain in any part that's affected, and pain while sitting down. Also, the brain will specifically give headache. Also, weakness of the part of the body, that the affected part of the brain is controlling. Okay? And just like in the case of nerve impingement, metastasis to brain to spinal cord can lead to frequent falls from weakness and paralysis. The gastrointestinal tract can present with decreased appetite. And you all agree with me that when there's decreased appetite, there will be decreased weight. Okay, so weight loss, decreased appetite. Also, still on gastrointestinal tract, there may be constipation. And you can easily agree with me, right, that the rectum is part of the navel, to the prostate gland. So when it is enlarged and the pressure effect is on the rectum, the large intestine, we are bound to be faced with constipation. That is one mechanism. Another one is this person has metastasis to the bones, nerve impingement, giving pain everywhere, and then you are giving painkillers, particularly narcotics. That on its own can give constipation as well. Now, hematologically, when there is bleeding, either hematuria or maybe as a result of the procedure or treatment or anything, and then we are faced with bleeding, particularly prostatectomy and everything like that, then we can be down with anemia. But before treatment, anemia might be the issue when there is massive hematuria. Now, symptoms of prostate cancer as it may affect the lungs. When metastases had reached the lungs, then the affected man can come down with cough. And the cough at this time will be worse at night. So some people might erroneously diagnose that to be asthma, because it was at night. The individual can also come down with shortness of breath, and recurrent pneumonia is another possible trouble. You remember, once there's a needle right there, then the bacteria may be able to thrive. Then there may be hemoptysis, and of course, pleural effusion. So someone with pleural effusion or hemoptysis. It's not always all the time that it is primary lung cancer or tuberculosis. It might be secondary, cancer cells from the prostate. Other set of signs and symptoms will be tagged as tumor lysis syndrome. I will not waste your time going through that here because there is a separate presentation on tumor lysis syndrome. If you want to listen to that, please kindly click on this very link. And there may be paraneoplastic syndrome. Full info on that could be obtained through this very link also. Okay, we have learned before reaching this point that the older we become, the more the likelihood or the probability of having prostate cancer, particularly black men, though that is it with every man all over the world, regardless of the race. But this is an animal, right? With the type of bad one that we may not even do anything about. I mean, when it comes to treatment, that's what we call surveillance or watchful and waiting, right? Because the individual will not benefit so much when there are other comorbidities or life expectancy is less than 10 years. So we might not bother anymore. So the individual will be a good candidate for palliative intervention. So that will be end of life. Now, remember the ladder I showed you at the beginning of these signs and symptoms, like the individual is already going down. But if you want to know more about everything concerning palliative management, end of life, and towards the time of death, then there are two presentations here. If you click on this and this, you will have all necessary pieces of information, even beyond that of prostate cancer.